Now, speaking of, we know that Halloween will be different this year, especially for children in Ontario's hotspots. The province has asked kids in those regions to refrain from trick-or-treating and explore creative alternatives instead. Now, families outside those regions can still trick-or-treat safely, according to them. So, are you following all this? What does this mean exactly? With some tips, we're joined by Dr. Martha Fulford, infectious disease specialist at McMaster Children's Hospital. Doctor, thank you so much for joining us on this very, almost surprisingly divisive topic. Are you surprised by that?
I am a little bit surprised.
It's so interesting. I mean, as we look forward to the next week, and as we try to make sense of all the rules and all the advice, because as you know, it is conflicting. From your perspective, how do you, if you're going to do it, how do you make it safe?
The outdoor activities are safe. I think a lot of us were actually very surprised at the recommendations that maybe children shouldn't trick or treat. It is outdoors, it is small groups, it is usually with kids with their own cohort, it's an incredibly easy time to mask. And so if you're going to make a decision about activities, this strikes me as one that would be in what might think of as a very green zone if you want to stratify activities by safe as in green, yellow maybe cautious, and red dangerous. Everything about Halloween would have been in the green zone. So it's a little bit surprising. I think,
no,
go ahead.
Forgive
Sorry.
me. I was going to say because... Yeah, I know this is the problem with the delay. But I'm curious as we look ahead and we try to make sense, because some people are still worried. Are there any other concerns, and perhaps the transmission on candy, for example, is that a worry as people hand out candy?
No,
okay.
No. We have not seen COVID being transmitted from surfaces, and it's not transmitted on food. If we did, we'd have a lot more outbreaks on places like Tim Hortons and other takeout, and that's not an issue. Having said that, there are safe things we can do. So instead of having a lot of small children put their hands into the same bucket, is spread them out on a baking sheet so that it's easy to catch to grab an individual candy. Use tongs so that there's no direct hand contact and you can give the candy to the child directly that way. I've seen, and I think you had a picture of that, people doing very creative things with PVC tubing and creating candy chutes where you can put it through that way. And these are all ways that I think it could have been made very safely. And one of the reasons that I think a lot of us are advocating for Halloween, it may seem trivial, but children are not particularly affected by the virus in terms of getting sick. And we know this very clearly, both in Canada and around the world. But they've borne a huge brunt of the cost for our response to it. Children need to be allowed to play. They need to socialize. They need to be allowed to have fun. They have to be allowed to begin to have a normal life. And Halloween seemed like such a safe an easy win in terms of allowing children to have some degree of a childhood back. Going forward, I think we do need to. COVID's not going away anywhere in the near future, and we do need to, I think, begin to have learn how to coexist and accept that some activities, not accept, but embrace activities that are low risk, like Halloween, and focus our attentions on higher risk activities where you're in really crowded areas, people who aren't part of your cohort. Poor ventilation, no masking. So there are areas that would be red, which I think we do need to avoid going forward. But the green type of activities like trick-or-treating, I was surprised. That it was their recommendations.
Now, you highlight something very important, because the provincial advice, or directive, if you will, defies so many medical expert opinions, including yours. Given that, in looking at the bigger picture, do you think, how real is it? We don't have a lot of time, unfortunately, but how real is the fear that people will simply reject provincial advice going forward, given the fact that this does not make a lot of sense to so many people?
I think it would be really helpful for all of us if we knew the evidence on the reason for recommendations, if it was clear that something had been, we had applied closures or caution with certain activities because we knew that transmission had occurred in those situations, and also that we focus a lot on high-risk people. So we know that the high-risk people for COVID are people in long-term care facilities
Yeah.
and the elderly with comorbidities,
No.
and maybe be a little bit more forgiving with children.
Doctor, you have to forgive me. I have to jump in.
Yeah.
We're up against the clock.
Yeah.
Dr. Martha Fulford from McMaster Children's Hospital, thank you so much.